Go ahead, Lisa.
Hi there, everyone. Welcome today to our presentation. My name is Lisa Honka, and I have a company called Your Key to Senior Living Options. I help seniors find resources in the area, such as independent, assisted, or memory care communities. Here is my information if anybody's interested in just talking to me. We are so lucky today to be joined by Lou, and she is going to be talking to us about sadness, depression, anxiety, and stress. We have some upcoming presentations through my Zoom calls, Dementia Do's and Don'ts, and that's going to be done by Jackie from the Alzheimer's Family Organization. That's going to be Thursday, October 29th at 10 o'clock. You can register for all of these on my website. Then we're going to be doing the Unleashing and the Power of the Mind on Thursday, November 5th at 10 o'clock, and that's with TLC. And then we're going to be having a presentation from Susan Richardson on how you can get clear captions in your home. If you have any hearing impairment, that is a free service, and you can get a new phone where you can actually read the information of the caller that's coming in as opposed to hear it. And then in 2021, we're going to have world-renowned Teepa Snow doing some presentations for us on dementia. And those, again, you can register on my website. So anybody who is working with someone with dementia, certainly sign up for those presentations. And again, all events can be signed up on my website, Your Key to Senior Living Options. So now we're going to hear from Lou from TLC. And thank you so much for joining us. It's a pleasure to have you. We've heard from you before, and you are a great speaker. So thank you again for joining us. We're looking forward to hearing what you have to say. Go ahead, Lou.
Okay. Thank you, Lisa. If you could go to the next slide, please. Okay, we're here today to talk about the difference between sadness and depression and stress and anxiety. These are all experiences that we have had throughout our entire life. They're well within a normal range to pathological. And so today we are going to be looking at the differences, looking at ways that they manifest in our bodies, and also to learn coping skills, no matter where we are on the spectrum of these emotions. And we're going to leave time at the end for questions and answers. So I hope that you've brought some of your questions with you. So what we're going to basically talk about today is how we react to these events, to stressors. What is your learning style? What is your ability to manage stress? And so we're going to pay attention to what our baseline in managing emotions is. Many of us are more easily frustrated than others. Some are more easygoing. Our life experiences play into our reactions to how we handle stress and sadness. And so this becomes quite personal. So we'll start with a definition. What is the definition of stress? Well, stress is a response to a challenge or a threat or a harmful situation. Our body reacts viscerally. We may have muscle aches, we may have tension, we may have headaches. These are all things that alert us that something may need to be happening. We may need to take some sort of action. In earlier times, when people were foraging the forest for food, anxiety, stress perhaps, was really important in alerting them to the danger of perhaps a tiger that might be coming. Today's stress might be more related to having to learn something new. All of you who are on this Zoom call had to learn how to use technology in a way that perhaps was not something that you had planned. That creates stress. That is all quite normal. It's necessary and it's unavoidable. Stress is usually situational. We may experience stress when we've lost a loved one, a pet. We're in a situation that is unfamiliar, maybe an illness, something new that requires us to have to think about a different way of reacting. So when we talk about stress, it's usually situational. How we deal with it really becomes the important factor. And one of the things that I really am looking forward to giving you today is a toolkit for you to work to have available so that you can deal with stress and sadness at any part of the range of those emotions. The definition of anxiety is really prolonged stress. It varies by duration and intensity. And oftentimes, anxiety is not only a more pervasive feeling, but it may be one stress on top of another stress on top of another stress. And so we lose the ability to cope as well as when it was just a minor stress and we can think more clearly. When someone has an anxiety diagnosis, they may feel overwhelmed. They may even be immobilized. It's hard to think clearly when you're overwhelmed. Sometimes we're not even aware of what the stressors are. In an anxiety situation, it may not be tied to a specific stressor. It may be more pervasive, as I said, more than one stressor at a time. Now, diagnosing anxiety is not that simple. Neither is diagnosing depression. It's not a disorder that you can see on an x-ray. You know, if you have a broken leg, you can x-ray it and see it. If you're experiencing anxiety or depression, it's not something that can be seen from an outward force. It doesn't show up in the bloodstream, so there's no test that we can do. So it's really important that we look at symptoms, and we'll talk about that in just a moment. But before we diagnose anyone with anxiety, it's really important that we pay attention to the possibility of some physical factors that may be contributing to this feeling. And so complete physical from your healthcare provider is really important. We want to rule out things like angina or a heart attack. When we're feeling anxious, our heart beats a little bit more quickly. We may have shortness of breath. Now, if you could stay on that other slide, please, I'd appreciate it. So it's really important to get a complete physical to rule out heart attacks. Asthma can look the same as anxiety at times. Sometimes thyroid disorders can look like anxiety, either hyper or hypothyroid. And then medication side effects can also look like that. So before and while we are dealing with the symptoms of anxiety, let's make sure that when we're ruling out something more serious. There are various kinds of anxiety. We're not going to go into all of them, but I just wanted to list them for you. You've probably heard of social anxiety, social phobias, panic disorders, which is a really high range of anxiety, obsessive compulsive disorder, and post-traumatic stress disorder. The good news is that all of these can be treated, and the sooner we get to treatment, the better. Next slide, please. So what are some of the symptoms of anxiety? You'll notice the symptoms in your body: muscle tension, headaches, clenching your jaw, your hands. Sometimes we're not even aware of where the tension is in our body. And it's really important to pay attention to that. And so stress is really tension. It's feeling overwhelmed, moody, having a difficult time calming yourself, and it's just a general feeling of unease. When things get more serious and we move towards an anxiety disorder, we have some of those same feelings that are in the first column, but then it amps up somewhat. We feel restless and irritable. I know that when my stress level goes up, one of my first tells is that I become more irritable. That's not my normal way of being. So when I find myself being irritable at small things, I know, okay, I'm a little bit stressed now. I need to go to my toolkit and use some of the resources that will help calm me. Difficulty with concentration is also a symptom of anxiety. When we are overly stressed and anxious, all of the energy that we use to battle that anxiety can affect our ability to concentrate. It may make us feel like we're a little bit in a fog. We can be very tired. Our heart might be racing. We might experience some sleep changes. People who are very anxious sometimes have a hard time falling asleep or remaining asleep. On the other hand, they may be so anxious that all they want to do is sleep. So any changes is a warning sign for us that these are symptoms. When we no longer can control how we worry about things and that fear seems to be overtaking our lives, that's when we know that we probably need some help in managing our anxiety. And of course, panic is another symptom. Next slide, please. Now let's talk a little bit about sadness versus depression. What is sadness? Sadness, again, is a normal reaction to many stressors that we might experience. We might feel sad when we've lost someone. A loss might be even that of a pet. You'd be surprised how deeply that loss can be for people. Please don't minimize that when somebody is feeling down and sad because they've lost a pet. They might be feeling lethargic. Basically, a good definition of sadness is emotional pain. And again, it's not the kind of pain you can see, but it's within you and it's deep and it hurts. And it deserves to be noticed, and it will get noticed one way or another. Sometimes people who are sad become lethargic. They withdraw. They kind of stay away from the world. It's too much effort to interact with people who are not feeling sad. So it doesn't always show on someone's face. You can tell when somebody is sad if they look sad, if they're crying. Those are clear signs. But many people don't express that sadness. That doesn't mean it isn't affecting them. Now, depression, on the other hand, is really a change in mood. It is the brain's difficulty in regulating your moods. So we refer to depression and all of the different forms of depression as mood disorders. Depression affects almost every aspect of a person's life. How they think, how they feel, how they behave, and how they function. It's a very serious illness that needs to be taken seriously. That's redundant. It can also be life-threatening. So we really need to pay attention. There are factors that come into play as we look at depression. There is a genetic vulnerability that in some families, and some of it may be a learned behavior, but people have more of a propensity for being depressed. That doesn't mean it's inherited. It doesn't mean that it can't be managed, but there are some genetic factors that come into play. The amount of life stressors that a person goes through is also a factor in understanding the level of depression that somebody might be in. And again, it needs to be treated just as seriously as a heart disease or diabetes. It's something that can affect our quality of life. Not only affects the person who has depression, but it affects the people around them. We want to be able to help them. Sometimes we don't know how, and sometimes we don't understand what they're going through. Again, to diagnose depression, it's really important that we get a complete physical. If you have symptoms that we'll be talking about in a moment, it is important that you see your healthcare provider to make sure that we rule out other possible cause for depression. Some illnesses have depressive side effects. I know that many of the people that I worked with who had Parkinson's often had a secondary depression that went along with it. That's beyond just the sadness of knowing that you don't have as much control in your life. Other factors that may come into play are caffeine, alcohol, side effects of medications. There are a number of kinds of depressions, including situational depression, adjustment disorders, major depression, which is always something that needs to be treated, bipolar disorder, the moods that go from highs to low, very different than just depression and really needs a lot of attention. There's also something called seasonal affective disorder. When I was working as a social worker up in New Hampshire, I saw a lot of people with seasonal affective disorders during the wintertime. I haven't seen a single one since I've moved to Florida. So that really is the proof of the pudding right there. And then there is psychotic depression. Next slide, please. Excuse me. So what are some of the symptoms of sadness versus depression? People who are feeling sad can also, at the same time, experience good feelings. People who are feeling depressed may have a harder time feeling joy. So one of the major factors that I see when I'm working with people is the intensity of the feelings. So in sadness, you might see somebody feeling down, blue, low energy, a heavy feeling. You might see them sighing more, a sense of apathy. And that would be if it's different from their everyday personality. We need to always keep in mind what a person's baseline behavior is. So when we feel like we have no control over our emotions, then we start feeling more towards the clinical aspect of depression. Someone who's feeling clinically depressed can't possibly imagine feeling any other way. It's as though all the good things that have happened disappear. They feel discouraged. They feel helpless and hopeless. They might actually display anger, particularly in the male clients that I've seen. Quite often, anger is the presenting emotion. Strangely enough, in our society, particularly for men, but for women as well, anger seems to be a more accepted emotion. It's more acceptable to be angry than it is to be sad. And so we talk about anger as a secondary emotion. Whenever you see someone who is not normally an angry person start to exhibit those behaviors, the question to ask is, what's underneath that? Is there some sadness? Is there some depression? You might also find that somebody who used to enjoy doing crafts or playing tennis or golf, all of a sudden has lost all motivation and interest. That's a real tell for depression. Low energy. And just as in anxiety, changes in sleep patterns can be noted. Again, when somebody is very depressed, it's sometimes hard to get up in the morning, hard to imagine themselves being able to put one foot in front of the other. On the other hand, sometimes people are so depressed that they're just wound up and they can't settle down. And so they may not be able to sleep, or they may get a little bit of sleep and then they're wide awake. And so lack of sleep, poor sleep adds to the feelings of depression and feeling overwhelmed in your everyday tasks. And then finally, of course, any thoughts of self-harm should be taken very seriously. Anytime you hear someone talking about whether life is worth living, whether the world would be better without them, that is something that must be paid attention to, and do whatever you can to get them to help. If this person, and even if it's yourself, if you are feeling those thoughts, particularly if it's a friend of yours or a relative, if they were to break a leg, you would drive them to the emergency room without thought. Well, when you start seeing that level of depression, that same kind of action is warranted. Find a way to get help for them. It's critically important. For a diagnosis of depression, anytime you see these symptoms that last over 2 weeks, and that the intensity is there, that's when we really need to diagnose them. That's the point that diagnosis is important. Next slide, please. So there are some warning signs that I need to share with you that you really should not ignore. A poor daily self-care, such as refusing to take care of their grooming, they don't want to brush their teeth. It doesn't matter if their hair is brushed or combed. They don't want to get out of bed. They don't want to eat. Nothing tastes good. Why bother? Those are really serious warning signs. Sudden changes in mood and extreme changes. Somebody who's functioned at a fairly decent level for much of their lives, all of a sudden is become more angry, more volatile, cries on the drop of a hat. These are things that are very serious and should be looked into. Violent or threatening or aggressive behaviors should always be considered when you're diagnosing someone. If you see that and it's different from their normal pattern, that may be hiding a depression. People start abusing substances. The person who always had one martini a day, all of a sudden their happy hour starts at 1 o'clock and doesn't end until they go to bed. Substances are ways that people think that they can cope better. And substance and alcohol in particular are what I call false friends. They do have a little bit of an effect. You might not feel quite as sad once you've had that drink or two, but it gets into a dangerous territory very quickly. And it becomes an added depressant. Alcohol becomes a depressant. So you add, I'm already depressed, I'm going to add something that makes me more depressed after a short while. It also interferes with sleep. As alcohol is metabolized, 1 or 2 o'clock in the morning, you're wide awake, and then all the thoughts that you've been trying not to think of during the day come barreling through. Someone who might appear confused or who's having hallucinations. Again, we talked a little bit about how when you're feeling depressed or very anxious, you might feel like you're in a haze or a fog, and that may look like dementia. And so the first thing people think of is, oh, it must be Alzheimer's, it must be dementia. Let's make sure we rule out that it might not be depression manifesting itself that way. Talks of suicide, as I mentioned before, always important to get help. So a doctor should do a full assessment to rule out any physical causes before or not even before, but as we look at other coping skills. Next slide, please. So I'd like to talk a little bit about mental health. I like to think of mental health as emotional health, emotional well-being. We have no problem talking about physical health, and especially if people in our age group, it seems like that's the first topic of conversation. People talk about their aches and pains, but people rarely talk about their emotional pain. And so let's clarify some do's and some is and is nots about mental health. Mental health, notice the emphasis on the word health, is something we all have. We have it in one degree or another. It's something that we need to look after. We know we need to look after our physical health. We know we have to eat properly. We have to get enough sleep and exercise. Well, we need to look after our emotional health as well. It's part of being human. It changes throughout our lives. Over time, we have different levels of stress and sadness and anxiety and depression. You'll notice that one of my best examples of that, of changing emotional health, is for women when we go through menopause. The emotions are there, and many other times in our lives, but that's one that's pretty clear. For men, it may be what we sometimes call midlife crises. They're all of a sudden they're not sure about where they belong in society, how important their job is, what's ahead for them. So mental health is something that changes throughout our lives, and we need to pay attention to it. It's worth making time for. And if we don't pay attention to our mental health, we may not reach our full potential. And that would be a shame, because we all have something important to give to our society. What mental health is not, it's not a personal failure. It's not a flaw. It is something that is part of being human. It is a reaction to the brain chemistry. It's not something you can shake off. The expression, they can just pull themselves up by their bootstraps. Well, we're not going to be able to use that expression for much longer, because I doubt that there are many young people who even know what bootstraps are. But the idea that they can just talk themselves out of it, just do something and you're not going to feel depressed, that's not true. Depression needs treatment. It needs tools to be able to work through the symptoms. It's not always something negative. Some of the greatest artists are people who suffered from depression and other mental health disorders. Monet, Van Gogh, a lot of good musicians have struggled with depression. And sometimes, you'll hear about musicians being on drugs and trying to manage their world and the stressors that come into their world through drugs and so on. They may actually be trying to mask their depression. So I think we need to be gentle and non-judgmental about people's behaviors. We don't know what people are going through. It's not something we should be ashamed of. If I had diabetes, or if I had a heart attack, I wouldn't be ashamed of that, or a broken leg. I would get treatment. Getting treatment for depression should not be an obstacle because of shame. And it's definitely not a sign of weakness. In all the years I've worked with the elderly, mostly in New Hampshire in the mental health system for over now about 35 years. And I have such admiration for people who have struggled with depression and anxiety, and how they've worked so hard to get out of those moods, get through them. It is definitely not a sign of weakness. Getting help is not a sign of weakness. It is a sign of strength. Next slide, please. So what are some of the effects of depression and anxiety? Well, as we mentioned earlier, you might have some physical effects. You'll have the racing heart. This can put a stress on your nervous system. It can even affect your immune system. And during this time of COVID pandemic, it's really important that our immune system be as healthy as it can be. So if you're experiencing symptoms of anxiety and depression, take care of that, not only for your emotional health, but for your physical health. And again, it can affect your memory. It can affect your ability to think clearly. It can lead to social isolation. Um, and social isolation leads to memory issues, which can lead to feelings of depression. So it becomes a vicious cycle at times. And the most important effect of untreated anxiety and depression is that it robs us of today. We waste our energy. We lose the ability of enjoying the very thing that we have. We can't control what happened yesterday. We have no control over tomorrow, or little control over tomorrow, but today is what we have, and we want to make the most of that. Next slide, please. So, understanding your thought process. I'm going to give you an example of a client that I had that will solidify this, the importance of paying attention to our beliefs and our thoughts. It's important that we are aware of our thoughts and our feelings. We need to stop and check in with our body, to check in with our mind, to see how we're feeling. And feelings, to me, I like to think about them as a 2-year-old. If a 2-year-old wants your attention, they are going to get your attention one way or another. They may start by kind of poking at you, mom, mom. And if you don't pay attention, then they get a little bit more loud, ma, ma. And if you're still not paying attention to them, they're going to pull on your shirt. They're going to get your attention one way or the other. They might even spill milk on the floor so that you'll notice them. Well, feelings are very much the same way. If we don't pay attention to them, they'll grow and grow and grow until you finally pay attention to them. So it's important that we being redundant again, that we focus on our thoughts and what our thoughts lead to our feelings. So the example I want to give to you is of a woman that I worked with in New Hampshire. She was 62 years old when she first came into treatment. Her family suggested that she go see a doctor because her moods were very, very different. This was an easygoing, accomplished person. And all of a sudden there was a lot of anger. She was crying at the drop of a hat, and they knew something wasn't right. So they brought her to the doctor, and the doctors did all kinds of tests, ruled out all kinds of things that might be contributing to this change in behavior, and suggested that she come and talk to me, to someone, to rule out depression. So when I first met her, I saw all of these symptoms. She minimized them, didn't have much energy, didn't even really want to be there. Kept her talking long enough to learn about her normal life, what life had been like. And come to find out, she had lived in Boston, in the big city, all of her life. Never needed a car, never drove a car. 62 years old, never had a driver's license, didn't need one. Matter of fact, when you live in the city, a car can be a real burden. There's no place to park them. If you are lucky enough to find a place to park them, it costs an arm and a leg. So she functioned. She was a professional woman. She used public transportation, used taxis when necessary. Her family would come and pick her up when they wanted her to visit, or she'd take the bus to visit them, and then they'd pick her up at the bus station. And the world was going pretty well. Then her daughter became ill, and she decided that it was time for her to take care of the daughter and the family. So she had planned on retiring early. So she sold her apartment in Boston and moved to a small town, and was very pleased. This was a decision she made. She was very pleased with the fact that she was making this decision. But it didn't take long for her to start feeling isolated. She didn't have a car. She didn't know how to drive. There wasn't public transportation. She had to depend on her family. So she felt worthless, useless. She started isolating herself, pushing people away. So I started working with her about her thought process. trying to figure out how can we help this person get through this difficult time. So I asked her what her belief system was about herself, and particularly around driving, because she's the one that brought up that issue. And she says, well, part of the problem is I'm too old. There's no way I'm going to learn how to drive. I'm 62 years old. That's really old. Well, there was a time when I was in my 30s, I thought 62 was old. I've changed my mind about that. But for her, she felt old. And so by feeling old and not seeing a future for herself, I explored with her what thoughts she had that came from that belief. And she said, well, I'm pretty worthless. I'm a burden. I'm a burden to my family. I came here to be helpful, but really I'm a burden. They have to drive me anywhere I want to go. There are things I'd like to do, like take an art class, but it's during the day and there's no way for me to get there. I feel like I'm thinking my life is over. And worst of all, I feel like I'm a really bad role model for my granddaughters. They're going to think that this crying, angry grandmother is what old people are like. And I don't like that about myself. And I feel useless. So we went from her belief that she's too old to change to feeling a burden, worthless, helpless, and so on. So I thought, well, what are some of the feelings you have? And this happened over several sessions, of course. So pulled out some of her feelings, and she said, "Well, I feel sad. Obviously, look at the tears. I'm sad. I feel helpless. I'm frustrated. I get angry all the time with myself, and I'm embarrassed. I'm embarrassed. This is not the person I want to be. It's not the person I thought I was, and I don't like that person." So then we look at her actions. Well, if she's feeling helpless and she's stressed and she's embarrassed, she's going to withdraw. And this is what she was doing. She pushed people away before they could push her away. She had this feeling that if people met her, they wouldn't like her because there was nothing there to like. And so I started challenging some of her beliefs. So the first belief I challenged was, is she too old to learn how to drive? Is that absolutely true? Has there never been a person who learned how to drive in their 60s? And she says, well, I don't know of anybody, but that doesn't mean there isn't one. So started just poking little holes in her belief system. Is it true that you're useless? It seems to me that you've moved to help your daughter and her family, and you seem to enjoy being with your granddaughters, and you're fearing that you're a bad role model. But didn't you tell me that they used to love to come to Boston, and you'd take them to museums, and you would take them to high tea was one of the things that they loved doing with grandma? Do you think they've forgotten that? Do they think that they only see the person that you're describing in this room? I don't think that's necessarily true, but we could test that out, couldn't we? So she agreed that maybe. She wasn't buying it 100%, but maybe. So I said, what if these were not true? Let's pretend that it is possible for you to get a driver's license and to feel a little bit more independent, because being independent was the main thing she missed, and being that role model. So what would it take for you to be able to get that driver's license? Well, I'd have to take driver's ed. Oh my God, taking driver's ed with all these 15 and 16-year-olds, that would be horrible. I would be so embarrassed. And I said, or you could probably be a role model for them, that it's never too late to learn something new. And there was just a slight glimmer when I said that to her. She was starting to buy into it. So she's, well, if I were, oh, now we're talking if, so it's not. So there's the progress. If I were to get my driver's license, I'd only want to be able to drive to the hairdresser, to the grocery store. I wouldn't go that far. Certainly wouldn't drive into Boston. And I said, well, you wouldn't have to. you could decide what level of comfort you're what level of driving you're comfortable with. She started saying, yeah, I could probably, because, the hairdresser is only about, I know how to get there. It's only about 4 or 5 minutes away. So then she started getting a little bit excited. And then one day she said, we were talking about my taking driver's ed. How cool would it be for the instructor to have to change what he has to say about, all these old people driving on the road and having me in the class? And that actually happened when she did take the class. At one point they showed a video, and it was of an old person driving very, very slowly. And the instructor was saying, when you see these old, and stopped in the middle of his sentence and said, excuse me, Mrs. Smith, I need to rephrase that. So there are different levels of drivers and so on and so forth. Well, she starting to enjoy the idea and the possibility of doing some changes. She went from I can't to this is exciting. I may never drive, but I'm going to get my driver's license. I'm going to do it. I'm going to show my granddaughters that any obstacle can be overcome. And so this is an example of how our beliefs, our thoughts, our feelings affect our behavior. And so this may be an extreme example for some of you, but if you look at any stressors that you have in your life, you will notice that if you pay attention to your thoughts and what your belief systems are, and you challenge them a little bit, you may find that things are a little bit more flexible than you might have thought. Next slide, please. So in addition to this example to give to you as a way of reframing your thinking, I want to give you some real concrete tips. When I work with people, I try to develop a toolbox for them. Everybody needs a toolbox. In your toolbox at home, you have a hammer and a screwdriver and nails and hooks and so on. You don't use everything every day, but they're there if you need them as fits the occasion. So this is one of the tools that I want you to have in your toolbox. And it's what I call a grounding exercise. If you're feeling overwhelmed, sad, stressed, and you're feeling that in your body and emotionally, take a break from that feeling and look around and use your senses, the 5 senses. Look around and find 5 things that you can see, 4 that you can touch, 3 that you can hear, 2 that you can smell, and 1 that you can taste. And by the way, we're going to be making this PowerPoint slide available on our website after we publish the video, so that you can go back to these things, maybe even print them out and put them on your refrigerator if you find them helpful. So looking at 5 things that you can see, and I'm going to model this for you, because it's not just a matter of dot, 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 and done. I see a computer, and I take a breath. I see a notepad. I see a tree out the window. I see my hand. I see a lamp. And I see a bush. Notice how you just gently look at those, using those senses. Then you look at 4 things that you can touch. I can touch my hands to each other. I can touch my desk. I can touch my shoulder. I can touch a glass. 2 things that you can hear. I hear the motor of my computer. I hear the refrigerator start, the motor of the refrigerator. I'm going to give you if I were outside, I would be hearing a bird or something like that. 2 things that you can smell. I smell the fresh air in my room. I used uh, a scented candle earlier to help calm myself, and I can still smell that beautiful cinnamon. If I were outside, I could smell the grass, things of that nature. One thing that you can taste. Okay. This is where I allow myself to, while I'm on camera, take a sip of my tea so that I can model tasting my tea. These are things that you do to ground yourself. While you're doing that, your mind is not thinking about other things. You've taken a break from your worries, from your sadness, and that's worthwhile. Next slide, please. So let's talk about managing our symptoms. Allow yourself to feel what you feel. It means slowing down. It means not judging your feelings. I'm feeling jittery. I'm feeling kind of antsy. I'm not judging that as a bad feeling. It's just what I'm feeling right now. It's part of my day. It's part of preparing to share this information with you. I feel a little anxious when I'm doing something like this. That's okay. It tells me that I want to do a good job. It informs me. Breathe. The easiest thing you can add to your toolkit is a reminder to breathe. When you breathe, you're bringing oxygen to your brain. You're allowing your body to relax. You breathe through some of the tension that's in your body. You might even do a mindfulness meditation. There's many of them available on YouTube. We have a few of them on our website as well. Just breathe. Allow yourself to be. Check the accuracy of your thoughts. You know, if you're feeling like you're never going to be able to get through this task is too hard, I'm never going to get over this illness, I'm doomed. Check the accuracy of your thought. Is that actually true? And is it true all the time? And if you challenge your thoughts, then you might change your feelings. Do something that you have control over. We all like to have control. And one of the things about being anxious or depressed is that we feel we've lost the control. So do something you have control over. It might be as simple as making your bed in the morning and looking at it, not as a chore, but something that makes your room look nice. You know, you bought furniture, you bought bedspread. Let's enjoy our choices. Do something that maybe decide what you're going to make for dinner or where you might go for dinner. Something that you have some control over. Might even be giving somebody a compliment. You have control over how you interact with people. And so giving somebody a compliment gets you the feedback of doing something good. Develop a routine, particularly when you're depressed. It's very easy to let go of everyday routines. Routine is something that gets us a little bit out of that vicious cycle of depression. So get up, brush your teeth, comb your hair, shave your beard or trim your beard. Do something that is a routine. Make your cup of coffee or tea. Sit and enjoy it. Be present. You know, taste the coffee, taste the tea or the orange juice. Don't just gulp it. Do something that is part of a routine that you're present with. When you develop a routine, you then change that pattern. Do something that brings you comfort. You know, the minute I say that, I think of a piece of Dove chocolate. That brings me comfort. You know, I'll savor that one piece of Dove chocolate. And again, it makes me present. Something that might bring you comfort might be a warm bubble bath. I had a client who was very, very depressed and really struggling with the loss of her husband. And one of the things that she found that was comforting to her is she took one of his shirts and she would wrap herself in the shirt. And of course, it made her feel sad, she was sad anyway. Putting the shirt on didn't make her more sad, but it made her feel like he was hugging her. That gave her comfort. She did that and she told her friends, and some of her friends poo-pooed that. Oh, you're going to stay stuck. I say, if this brings you comfort, go for it. And she did that for a while. And then at some point she says, I don't know when I stopped needing to do that, but I'm not doing it anymore. So that was kind of a check and balance for her. Go for a walk, look at the environment, see what's around you, observe the beauty around you, really see, how many shades of green are there outside your door. Talk to a friend, whether on the phone or Zoom. Speaking of friends, something I meant to mention earlier is when you have experienced some sadness or some stress, it's good to talk to a trusted friend or a therapist about this so that they can help you. If I tell a friend that I'm feeling really anxious, as a matter of fact, I did that just the other day. I was feeling a little bit unsettled. And the friend said to me, I think it's time for you to watch Property Brothers. That's my guilty pleasure. I love watching Property Brothers. Gets me out of my head, lets me see what other people are doing. By having told her that that's one of my coping skills, she was able to remind me when I needed it. And I'll do the same for her. I'll say, it's been a while since you've put your toes in the pool. Maybe it'd be a good time to do that right now. Understand what is and what is not within your control. We have some videos on our YouTube channel, on our website, and there's one called the Control Box. If you want to learn about things that you can control and things that you can't control, that's a really useful tool. Also, plugging TLC again, the cognitive behavioral therapy that I modeled with you with the client with the driving, there's a video that we did recently, a talk that we did recently, if you haven't had a chance to see it, how what I say in my mind controls how I live my life or how I feel, something to that effect. It might be worth taking a look at that if you have an interest in that. And to wrap up, next slide, just understand that many of the feelings you're having are well within the normal range, especially during this COVID time. We're feeling sad. We're feeling a little bit frustrated that we're not able to do the things we wanted to do earlier on when we retired down here. A lot of the activities might not be wise for us to partake in. We're not necessarily going out to eat as often. These are all normal feelings, but sometimes these feelings bubble up and get more serious. And so we want to pay attention to what we are experiencing. Make a plan, have a toolkit. Some of the coping skills that we talked about, you have lived your entire life coping with different things. You have your own unique coping skills. Take a moment after this presentation and write down a few of them, and then metaphorically put them in your toolbox. Or, as oftentimes I'll do with clients, and I'll have them put them on the refrigerator so that they can look at them, so that they will reinforce in their brain that these are things they have control over and that they can do. Make sure you talk to a medical provider if your symptoms look as though they're lasting longer than a few weeks, or the intensity or duration is greater than your norm. Be kind to yourself and be kind to others, and have a hopeful attitude. Our attitude really affects our behaviors and how we feel. Next slide, please. And I'd like to leave you with this is one of my favorite quotes from the Dalai Lama. When you can't control what's happening, challenge yourself to control the way you respond what's happening. That is where your power is. Next slide, please. So that is what I'm offering you today. And I just like to, and I hope that it's been helpful. Um, I'd like to tell you just a tiny bit about TLC. We are a group of about 20 retired professionals in the field of mental health that decided that our skills were something that other people might benefit from, and that also feeds our need to be needed. We provide presentations, support groups, some one-on-one counseling, and trainings for people who are offering other kinds of groups. Our services are free of charge. Next slide, please. We do have some upcoming events. There's a Zoom presentation on November 5th. Pat Hayes, our director, is going to be talking about unleashing the power of your mind. And then we have a monthly Ask TLC morning show that we provide. And the next one is on November 12th from 10 to 11. And this time we're going to have a panel of 4 of our TLC consultants talking about veterans and their families. That should be, and that's the day after Veterans Day, so that should be interesting. And finally, last slide, I'd like to thank you for your attention. Feel free to visit our website at tlc-services.org. Our email is info@tlcservices, and again, that will be on our website. And again, our services are all free, but we do have expenses, and so we appreciate donations. And there's a donate button on our website, as well as an address where you can send a donation if you so are inclined. So with that, I'm going to send it back to Lisa.
Well, thank you, Lou. I think we learned a lot from you. So thanks for sharing all your knowledge with us. Does anyone have any questions? I have a couple questions, but I want to let the audience submit their questions either by putting it in the chat or even raising your hand. I can actually see all of you who've allowed us to see you through video. So I'm just going to ask a couple questions real quick. And again, we kind of time out at about 5 after. So I want to be sure that we get anybody in that has any questions. So certainly put that in the chat box, which is located at the bottom of your screen. So my first question is, what do you say to someone who seems down or depressed?
So when you see someone who's down and depressed, one of the things that first thing that comes to mind is you don't necessarily have to say anything. You can just be. You can be with them. You're not going to talk them out of their depression, but you can be an understanding person. You can be present for them. You might say, I understand you're going through a tough time. I'm here to listen if you need me. But just be there for them is probably the best thing you can do. And then if you see that the depression reaches the level of real concern, you can be that person that says, would you like me to go with you to the doctors? Might be helpful. Now, it's a little harder during these COVID times, but I imagine that most doctors' offices will make exceptions if you need to bring a friend with you to speak with you about some of the things that are going on. So encourage them to develop some coping skills, share some of your coping skills, but make sure that they get the help they need.
So is this one of those situations where if you see something, you say something? If you see them maybe not as tidy as they once were, or seeming a little withdrawn, or seeming a little blue, or if you try to go over there and they're not dressed later in the day, it's not something that you would ignore. It's something when you see something, or even when you hear something on a phone, right? You're talking to maybe a sister-in-law out of town. This is when maybe you say something. I acknowledge that I hear what you're saying, or I see a change. Can you tell me how you're feeling?
Right. Avoid the tendency that we have to want to fix something.
Mm-hmm.
Engage them in talking to you. Have them express what they're feeling. And just listening is a great gift.
So what if when you're around someone and they're really sad, right? Because sometimes this is really hard and you really start to feel down. how do you manage that when you're around somebody who's perhaps either going through a significant illness, right? A long-term illness, or they've suffered a major loss, a loss of a child or a spouse, a partner.
Mhm,
How then, if you're feeling sad because you're around that person, how do you
mhm.
cope?
Okay. Well, first I'd say congratulations. You're human. If you're feeling a sadness, if you're feeling their feelings, that is being mirrored to them. It helps them understand that what they're experiencing is within the normal range. If they're going through a serious illness, of course they're going to feel sad. And if you are feeling that experience as well, then you're letting them know that they're okay in expressing that in front of you. Now, you have to protect yourself. You may choose to be a little bit careful about how often you are physically with them. So you may um, do things that are physical rather than be present all the time. So, my claim to fame in the neighborhood is if anybody's sick, they get chicken soup. There's always chicken soup from the Karatzas household. Doing something is as kind and as important as being present. So a little bit of both, find a way, send them an uplifting message. On my phone, I have all kinds of little thoughts of the day. One of them that I've sent to many people is, if a hug could make you feel all better, I'd be there with a hug right now. And there's a teddy bear and he's hugging. Just letting them know that you're thinking of them. It doesn't mean you take on their illness, they take on their feelings, but you let them know that you care.
Right. So checking in with a phone call or a text or an email
Yeah,
or a pretty
yeah,
little note or a couple little flowers or a meal,
yeah,
right? Or even just, again, your gift of time, sitting on the
mhm,
driveway, socially distanced, just saying, hey, I'm
yeah,
here. Send you in a virtual hug, right?
yeah, yeah,
Does anyone have
absolutely.
any questions at this time? I
I did.
have one. Oh, go ahead.
I'm Terry
Hi,
Devine.
Terry.
Came in a little later. I'm sorry.
Hi,
Um, I,
Terry.
I have a question for Lou. In your presentation, you were talking about in the area of depression how you would kind of get foggy and not be able to put your thoughts together. My
Mhm.
question is that like something called fibrofog, which people with fibromyalgia at times get?
Hmm. It's not a term I'm familiar with, but it certainly sounds accurate. A fog, that feeling of a wet blanket over you that you just can't. It's hard to get your thoughts through.
Mm-hmm.
So it is that a fog, a heaviness that affects your ability to think clearly. And so when we feel ourselves in that fog, um, it's a hint that we need to do something. And
Thank you.
again, some of the hints that I gave you, get out of your head for a moment and do the sensory exercise. Pay attention to something that feels good. That may help clear a little bit of the fog. And again, medications when someone is having a clinical depression, medications can balance the chemicals in the brain. The combination of medication and talk therapy is usually the best. Not everybody can tolerate certain medications, but it's certainly worth looking into.
Thank
And seeing a therapist, a counselor, or even a very good friend that you can say whatever you need to with, and then they won't judge you is really important.
So I have one more question, but we may time out on this, depending on how long the Zoom call is. But I just wanted to ask this to kind of acknowledge where we are as a world and as a country and as a state, right? So it's normal for people to be sad or depressed or anxious. but this is extraordinary, right? So in normal times, right, and just a normal depression, anxiety, fearfulness, there is usually a normal period of time in which somebody would feel sad or depressed, but this is prolonged, isn't it? And so what we're feeling is maybe something we've never, ever encountered, right? And so this is harder than anything we've ever been through as a country, as a family, as an individual, as a couple, as a parent, as a child. How do we, I mean, really, you've given us some great coping skills, but we also have to acknowledge that this is real, right? What we're going through is really real. And there is no even data on this. This is like PTSD. We're all having it and we're really struggling through it.
We are.
So,
And, you know, you also have to remember that we started off prior to the pandemic with all kinds of issues. You know, stressors are there in our lives anyway. You know, moving to a new community is stressful. New relationships are stressful. And then on top of all of those stressors, you add this pandemic with the heaviness of not knowing when this is going to be over. You know, it will be over. At some point, it will be over, but it will be a while before we can get back to our normal way of being. I think one of the things we have to be careful about is maybe not inundating ourselves with too much news. You know, one of the things that I recommend for people is 2 things to avoid: too much news and standing on a scale during pandemic time. You know, it's good to be informed. You want to know what's going on, but this 24-hour news can be very, very depressing. So limit your exposure. Understand that this is new. This is new for everyone, and everyone is reacting differently. Again, based on their history, based on their personalities and their temperaments, you're going to see different ways of coping. So being kind, being understanding, taking good care of yourself, and having that hopeful light at the end of the tunnel. There will be a vaccine at some point. We will get through this, especially if we're mindful of being concerned about our own health and that of our neighbors.
yeah. Well, thank you. Any other questions at this time?
I see Ellen. She'll
Oh yeah,
have to
Ellen.
we'll
Can
have
you
to
unmute your microphone, Ellen? There's a little button in the far right corner, Ellen, and you want to put unmute, or
I
maybe
got it.
Maureen can do it. Thank
I
you,
got
There we
Ellen.
go.
Go ahead.
Thank
Good
you.
girl.
No, I find that this election has taken a tremendous toll on me. I'm very concerned about the country, my family, everything, my age, my health, and the constant bickering between these 2 people, Trump and Biden, are driving me crazy. And I know it's coming to a close, but I'm really concerned. And I find it, even when I go to bed at night, I dream about the election. I don't even know.
So one of the things that will be particularly important for you is understand that at some point in the very near future, we will have a decision. Control what you can. So make sure you go out and vote, that you support the candidate of your choice, and limit your exposure. And when you start having thoughts that get into the way of your sleeping and you know, just ruminating, think of something different. Have yourself prepared to think of something that will replace those negative thoughts.
Yeah, I've tried
Go ahead.
very hard to basically, a lot of my friends will call me or I will call them, and we somehow get on this politic discussion. And I'm trying to stay off of that now because the opinions are so different, and it's making everyone angry with everyone.
Yeah. Well, one of the things that I've found myself saying to people is, today's a politic-free day. I'm sorry, we can't talk about that today.
Good. That's great. I like that.
And people actually respect that. You know,
I like that. Thank you.
Yeah, we have different opinions, and people we like may have different opinions from us, but I have the right to have a politic-free day, and it might be every day. They don't have to know that.
Thank you very much.
Okay, good. Well,
That
thank you
was a
so much
great
for your
question.
attention.
I think Angela, do you have a question? I saw you raise your hand. Can you unmute your mic? There you
Yes.
There you go.
I have a sister in Michigan with depression and anxiety, and I would like to share this entire presentation with her. Will it be on the website in such a way that she can see the slides and hear your
It
voice?
will be. It will be. We probably in a week or so, we will clean it up and have an introduction, and our best friend David Hovel will put it on the website, and just by giving her the tlc-services.org, she'll be able to see it. And we
Wonderful.
appreciate your passing them on, because during this COVID time, we're not able to see people live. We're not able to be in the rec centers. And so doing these Zoom presentations has created a challenge for many of us. I much prefer to be in person with someone, but at least we're able to reach more people by sharing the video. So share it to your heart's content, and we appreciate that.
Wonderful. Thank you.
Thank you for that question.
Well, I think that's it for now. So this has been one of the
Actually,
best
we have one more
presentations.
person.
Whoop, we have one
another
more question.
Yeah, Beck.
Is that
here in
Beck?
the corner. Yeah.
Beck? Oh, there she is. Go ahead, Beck.
Hi.
Go ahead, Beck.
Hi, thank you. Lovely presentation. Thank you. God bless everybody. I've just gotten out of the hospital. When you talk about depression and anxiety and how sick we can get from it, I've been very, very ill. I'm grateful to be home, but still struggling. And I'm alone. Do you have a support system or support groups that get together and in some way, I don't know, the COVID way, the Zoom, I guess, to help with support in situations that are really overwhelming? And
There
I have
are
a very
some-
sick daughter. I'm sorry.
There are some support groups going on in the community, and we provide support groups from time, over time. I'm gonna punt this over to Pat Hayes. Pat, can you unmute yourself and tackle this question a little bit more than I can?
Yes, we've started a group and they've kind of taken a little vacation for a minute, but as of November 18th, am I right, Terry? November 18th, they're going to start the group again, and it's basically coping when you're alone. Okay, that might be suitable for you. Again, if you go to our website, especially at the last page, events and information, you can see everything that we're going to offer and when it's going to happen and how.
And if Beck wants to reach out to you, Pat, because she'd like one-on-one counseling, or if she has some questions about upcoming services that you might offer, she would go to the website. So Beck, do you see the TLC slide on your screen now? Do you see that? If you even take a picture of that, you can have it on your camera, right? And you can refer back to that. So Pat and Bonnie will take questions. You can email them or call them, and they can get you in touch with what you might be looking for.
Yeah, this is my phone number if anybody wants to call on our website.
Okay. And check our website periodically, because we're always starting new groups. We have new presentations, and there's also some really good information on there that you can peruse, whatever.
And I think what would be nice too is if people are looking for specific topics, right? Sometimes our ideas come from the audience, right? So if people are struggling with different mental health topics, maybe they could send Pat an email and just kind of talk about this, because this is one of the most popular presentations we've had with the most people on. So obviously this resonates with the audience. So again, if people would like to send questions or perhaps upcoming topic thoughts, that would be great. So thanks everybody for joining. Stay peaceful, stay hopeful,
care.
stay
Bye.
safe. And thanks again for joining us. And Lucille, thank you for your time, energy. Bonnie, Pat, and everybody, thank you so much. Have a great
Thank
week.
you.